Assalamu alaikum. Welcome to another episode of the Halal Food Podcast. Again, we have an August visitor from Turkey, and we're going to invite him to introduce himself. Dr. Mohammed.
Assalamu alaikum warahmatullahi wabarakatuh.
Alaikum salam.
Welcome, Doctor, and to all of your listeners and people who watch your podcast.
Yeah,
My name is Mohammed Alsheikh. I am originally from Syria, Turkish citizen now. I
alhamdulillah.
am working in SMIIC, Standard and Metrology Institute for Islamic Countries, as a specialist now. I am PhD holder of clinical pharmacy, specialized in halal pharmaceutical. Also, I am responsible for halal technical committees for halal food, halal cosmetics, and halal pharmaceuticals. Halal medical, we call it now halal medical issues in SMIC General Secretariat.
Yeah. Thank you, Dr. Mohammed. Can you tell us what SMIC is?
Simply, to have quality in your product, we need different sectors to work on the quality. These sectors are standards,
Yeah.
metrology, and accreditation.
Mhm.
So to organize the quality in any country, in industry, usually in this industry, we need to produce standards.
Yeah.
So we have equivalent in international organization like ISO, which produce standard for the whole world.
Yeah.
But the equivalent for OIC countries, for Islamic countries, is CIMIC. So simply we produce standards. We make standards for OIC countries. OIC countries is 57 country Organization of Islamic Cooperation. They are with majority of Muslim population, and they are the voice of Muslim people around the world.
Alhamdulillah. Alhamdulillah. Okay, so you did tell us you've got a PhD in pharmaceutical, and you also mentioned the fact that you're now trying to categorize it into medical to include other sectors. What is the difference between halal medical and non-halal or conventional medical? So, for instance, if somebody is going to take a drug, what is the difference between a halal drug and a conventional drug? Or if you're going to do operation, is there any difference in operations between halal and non-halal? Can you please explain that, please? Yeah,
Let's differentiate between pharmaceutical and medical first of all, then
yeah,
between halal and non-halal.
yeah.
Uh, f- our technical committee name was Halal Pharmaceutical Issues. So this technical committee should produce standards in halal pharmaceutical. Pharmaceutical means anything related to medicine,
Yeah.
the medicine that we take it or injected,
Mm.
all this pharmaceutical, what we call it pharmaceutical. We have another sector, we call it medical devices.
Yeah.
Medical devices is also wide, big sector, which, for example, the wheel, chair wheel, this is medical devices.
Mm, mm.
Some dental, what you call it, implant, this is medical
Implants. Yeah.
devices.
Yeah.
We have wide range of medical devices.
Yeah.
So we'd like to make a standard for medical devices,
Mhm.
and our technical committee is only pharmaceutical. We change the name and we expand the scope of the technical committee, and we call it medical issues, halal medical issues and services. Also, we add the word services because you know that there is difference between a product and service. The
Yeah.
product is something that you can touch. Service is something that just someone will provide for you. So
Yeah.
in the future, we will make some halal medical service standard.
Mhm.
For example, how to do service in the hospital, how the hospital can be categorized as halal hospital, some related services for the Muslim patient in the hospital. So now the name is big name,
Yeah.
medical, which is include pharmaceutical, medical devices, and also services. This is the one. Uh, when we come to the halal and non-halal, you know, as Muslim, we have some food dietary laws
Mhm.
which prohibit some products,
Yeah.
mainly porcine or big products,
Mhm.
blood, and some other animals which we cannot eat.
Yeah.
Same thing will be for the medicine. And in simple language, we can say the pharmaceutical, halal pharmaceutical, it should be free from any non-halal material.
Yeah.
And also during its process and manufacturing, It will be also free from any non-halal material.
Mhm.
And also the packaging, the final end will be also free from any non-halal material. So this is the difference between halal pharmaceutical and non-halal pharmaceutical. It's 100% halal. There is no contamination with non-halal in any process.
Yeah. You see, it's important. You just mentioned something very important, which I'm very pleased with. You say you have a technical committee because in every field, you will need, even if you have your organization, you still need external contribution of experts so that you can make better decisions. Why did you decide to form a technical committee when you could make the decision on your own?
Mm. Actually, this is the way how they make a standard. To make a standard,
Yeah,
uh, let's define the standard first of
yeah,
all.
mhm,
Standard is a document
yeah,
which set the rules,
yeah,
and or we can say the must. It should find in one product or
mhm,
service,
yeah,
okay, and it's made by consensus. Consensus that all people agree on this. What inside this standard?
yeah,
Usually, it's produced by organization
mhm,
which have the power to make this standard,
yeah,
and by the agreement for all stakeholders. Stakeholder, anyone who will use the standard. So to make nice standard, good standard, you
mhm,
should involve all people who related to this standard.
absolutely.
I'd like to make a standard about car. So I
Mhm,
should invite the car manufacturer,
yeah,
the government related bodies,
mhm,
the private sectors, the consumer protection organization,
yeah,
NGOs sometime,
mhm,
according to your product or service.
yeah.
Okay.
So, yeah,
So
uh,
in CIMIC, we have technical committees. This is
yeah,
how they make
mhm,
uh,
mhm,
a standard all around the world. Our technical committees, each country from OIC country, our
mhm,
member countries,
yeah,
send their expert. They send expert from all field,
mhm,
from
mhm,
government, from private sector, from Islamic department. This is the most important
mashallah,
thing
mashallah.
because our standard now CIMIC make standards in everything, not only in halal issues, but we focus more on the halal issues. We
Yeah,
have 17 technical committees.
mhm,
Five of them is halal based technical committees. We have halal food, halal cosmetic, halal medical, halal supply chain, halal management system, all of
mhm,
these things. And every time in our committee, also we have the Islamic Fiqh Academy people who come to our meeting for the
mashallah.
halal part.
Mhm, mhm. That is very interesting because what SMIC is doing is vital to those of us living in Muslim minority country because in Muslim majority countries it's easier to find a product that is halal, but in Muslim minority countries like we those living in Europe it's very difficult. So I really appreciate the work that SMIC is doing. The other difficulty we face in Muslim minority countries, again in Europe and other parts of America and other places, is the availability of halal pharmaceutical products. So, for instance, if I'm given this as a pharmaceutical product to take to save my life and it's not halal, what would be your advice to a Muslim advice to take a product that is not halal to save his life?
Mhm. Uh, Actually, let's make it step by step
Okay.
because I
Yeah.
need to to explain completely to the patient so
Yeah.
they don't understand the fatwa in different
Absolutely.
way.
Yeah.
Any medicine is made from two parts, active ingredient
Yeah.
and something we call excipients. Active ingredient is the part which is responsible for the action, which will give pharmacological effect, what we call it in our language.
Okay.
So, for example, paracetamol tablet,
Yeah.
the active ingredient is paracetamol. Okay,
Okay.
the main active ingredient. It's
Mm-hmm.
500 milligram paracetamol.
Paracetamol.
They add other material. They add
Oh.
starch. They add some sodium stearate, magnesium stearate. They add some other things to make it easier to fabricate as tablet.
Yeah.
Okay.
To bind together and also make
Yes,
it
we
last
have
longer.
binder glidance
Yeah.
and what you call it, disintegrant. Every material we added, it has some function
Yeah.
in the
Absolutely.
tablet.
Yeah. Mm-hmm.
So all of these excipients can replaced by another excipients. For example, now, for example, I have excipients. The goal of this excipients is to disintegrate the tablet, make it
Mm-hmm.
small pieces when it's go to the
Yeah.
under in the stomach.
Yeah.
So I can replace one excipient by another excipient, but I cannot replace the active ingredient by
The
another active
paracetamol. Yeah.
ingredient.
Yeah.
Okay. Our problem in halal pharmaceutical that a lot of excipients is يعني non-halal. Okay.
Okay.
So they put it in the tablets and the tablets become non-halal. Even the medicine is halal.
Yeah.
Okay. For this reason, in OIC countries, we don't have this problem. Yeah, it's not we don't have it, we have it, but less than non-OIC country. The excipient problem is less in the Muslim countries,
Yeah.
but it's more in the non-OIC countries. For example, gelatin or gelatin capsule.
Hmm.
The gelatin capsule in OIC country, most of them they use halal gelatin.
Yeah.
So you can take the capsule easily and you know that it's not from non-halal
Yeah.
source.
Yeah.
While in non-OIC countries, non-Muslim majority countries, the majority of them is from porcine. So even if the medicine is inside is halal,
Yeah.
they contaminated with
Oh,
non-halal.
sign. Yeah.
There is another now let's go to the active ingredient
Yeah.
to the
Yeah.
medicine.
Hmm.
There is around, let's say, 129 non-halal ingredient from porcine, but some of them is يعني critical for life.
Critical. Okay. Hmm.
And there is around 400 medicine which is come from cow or bovine source or other animal source, but they are not slaughtered according to the Islamic way.
Yeah.
Also, they are non-halal. So
None
this is
halal.
the problem. But the halal pharmaceutical also we have problem in the OIC country. The medicine that we import from non-OIC countries also they have this problem. So we have big problem in halal pharmaceutical more than food, more than cosmetic.
Yeah.
But we have fatwa. This fatwa allow Muslim people to take medicine if it's contain non-halal material, if this medicine is life-saving. Okay,
Okay. Okay. So that's
but
very important. That's very important.
but what is the meaning of life-saving? How we
Okay.
can define life-saving? Um, According to the WHO, life-saving is medicine. If you didn't give to the patient, it will lead to death
Okay.
or organ failure. One of the organ will not work properly. So there is a lot of medicine we classify it as life-saving
Life saving.
medicine. But when we go to the real life, there is a lot of medicine we need it, but it's not life-saving.
So would you say paracetamol if I have a headache and I take
Yeah,
paracetamol? Is that life saving?
this is not life-saving. Yeah, okay. And يعني the fatwa need to be يعني very accurate in this issue, and it's need to be how to say it? Someone what's called explain the fatwa in the language of the medical doctor. This is why a lot of fiqh people said it's allowed if a Muslim competent doctor prescribe it.
Yeah.
So the doctor will decide. They give the decision to the doctor or to the pharmacist who know the medicine, and he can estimate the situation if it's good or not. Is it good to avoid the medicine because of porcine source, or it's good to give it because it will not affect, inshallah.
Yeah. You see,
So
yeah.
there
Uh-huh.
is
Uh-huh.
there is a class for this fatwa. I will let you
Yes.
know about it later, inshallah. Yes.
Yeah. And it's good you've taken your time to tell us the difference between the active ingredient and another one which is not active because many people, well, a person like me, I haven't got any background in pharmaceutical, so I wouldn't know all the nitty-gritty of
Yes,
pharmaceutical.
this is very important because
Yeah.
the factory can easily replace the excipients.
Yeah.
It's
Yeah.
easy for them to replace. So it's just needs some action from the government, some
Hmm.
action from the Muslim people,
Yeah.
some demand from the Muslim people. If the Muslim people start to ask, we need this medicine in halal way, okay,
Hmm.
the
Hmm.
factory will make this action
Yeah.
because it's
Yeah.
will not affect the factory. There is no need for research for this one. They
Hmm.
just replace one material by another material. I give you one idea every time
Yeah.
I give it for my student.
Hmm.
Uh, let's say this is lemon cake.
Yeah.
Lemon cake. What
Hmm.
is the active ingredient? Is lemon. I
Lemon.
cannot call it lemon cake without lemon.
Yeah.
So I must put lemon. This is the active ingredient.
Hmm. Hmm.
But the cake, sometimes I don't have eggs. I can make cake without eggs.
Yeah.
Sometimes I don't have sugar. I can make cake without sugar.
Without sugar.
I replace the sugar with another material. I replace the egg with another material. So in pharmacy, we can replace this one.
That's
The problem
interesting.
with the active ingredient,
Yeah.
this one, that's if you want to replace, you need to search for another source,
Yeah.
make research, and this research costs a lot in
Yeah.
pharmaceutical. It
Mm-hmm.
start to cost from 500,000 to few 10 million
Mm-hmm.
to make medicine from A to Z. And this is we don't have investor until now in people who invest in these things, unfortunately. But this is very important sector for Muslim people.
Yeah.
And let's classify something according to the fiqh. As Muslim people, we have fard ain and fard kifaya. Fard ain, that's all Muslims should do this thing uh,
Okay.
in person. So
Mm-hmm.
fard ain for you is to make salah. Fard
Mm-hmm.
ain for you is to fast in Ramadan, to make zakah if you have money. This is fard ain.
Yeah.
There is fard kifaya. That's mean only fard for some people. If they didn't make this fard, all Muslim ummah will become sin for these things. For as pharmacist,
Yeah.
the fard kifaya is to make halal pharmaceutical for all Muslim people.
Mm-hmm.
If all pharmacists around Muslim world don't do this thing,
Yeah.
all pharmacists will be punished at the akhirah.
No.
Because this is our goal. Allah subhanahu wa ta'ala give us this as pharmacist. As veterinary, your goal is to do this.
Mm-hmm.
As doctor, your
Go
fard
is to
kifaya
yeah.
is this.
Mm-hmm.
So the fard kifaya for pharmacists around the world and for the medicine company around the Muslim world
Yeah.
is to produce the halal alternative.
Yeah. Yeah. Yeah.
Okay.
Yeah.
It's not the job of the non-Muslim people. Some people said,
Absolutely. Absolutely.
let's the non-Muslim people make the alternative, then they sell to us. It's not logic.
Yeah.
We should search for the alternative and find it and make it in our countries also, and give it to our people, inshallah.
Yeah. I'll
So
give
this is very
you
important.
yeah, something very similar to the scenario you've given. In 2003 in the UK, a lot of halal butchers were selling chicken that was halal, but the chicken was injected with water. But when the authorities here tested the water, they realized that pork protein was in the water, so that if they pump the water in the chicken, the water could bind to the muzzle and then increase the weight of the chicken. So the chicken may have been halal, but the injected water contained porcine.
Yes, this
Yeah.
contamination is a very problematic issue.
Hmm.
Maybe everything is okay, but it's
Yeah.
contaminated
Yeah.
with non-halal. It's become non-halal.
Yeah.
It's
Yeah.
like someone make you, for example, dish. At the end, when he finished, he bought some najis material. Let's say
Yeah.
najis material. Anything, you will not eat it. Yeah, this is logic.
Hmm.
Or if someone just make cake and he bought one drop, two drops, and he mix it and told you eat, you will not eat.
Yeah.
This is the
Absolutely.
same
Absolutely.
principle for this one.
Yeah.
So even the capsule, gelatin capsule, we know that only the capsule is not halal, but all of it's become non-halal because of this contamination.
Absolutely. Yeah.
Mhm.
That's correct.
But
That's
as
correct.
Muslim who is living in non-OIC country or Muslim living in OIC country, it's your responsibility to check the medicine, uh, what's called ingredients,
Ingredients. Yeah.
if it's halal or not halal, especially this critical one, the one with gelatin and the dietary supplement. Why dietary supplement has different classification than normal medicine? Because dietary supplement it's not medicine. In
Mhm.
classification, it's not medicine. It's food.
Okay. Hmm.
And in food, it's not halal to consume because there is no life saving. There is no need for this dietary supplement. So we
Hmm.
cannot apply the rule of the dietary supplement on the halal pharmaceutical.
Yeah.
Okay. Dietary supplement is any multivitamin, what you call it, this vitamins, this some proteins, all of
Hmm.
them. If you take them without prescription. They don't have uh, pharmacological effect, we called it.
Hmm.
They don't have indication to treat disease. They call it claims. They claim that this supplement for this use. It's not allowed in Islamic fiqh. to take non-halal dietary supplement.
Okay.
So this is your responsibility as a
Yeah.
consumer.
Mm-hmm.
As for medicines, and the one that you cannot check the ingredient, you don't know, you are not a professional, the responsibility go to the doctor and pharmacist.
Okay.
You
Okay.
know,
Okay.
if each Muslim doctor and pharmacist, they should study halal pharmaceutical
Yeah.
and know what is the medicine, which one contain non-halal, which one contain halal, and they should replace the non-halal with the halal one because there is alternative.
Yeah.
They can replace,
They
but they
can.
should study and know. The problem now that among all OIC countries, Muslim countries,
Mm-hmm.
unfortunately, we don't have pharmacy school or medicine school which teach a student, the doctor or pharmacist, what is halal pharmaceutical, what
Yeah.
is
Yeah.
not halal. It's not
Mm.
curriculum. They teach some Muslim country, they teach them medical fiqh. Medical fiqh is how to treat the patient, what you call it, IVF, in vitro fertilization
Mm-hmm.
for this operation,
Yeah.
how to teach male female segregation, but they don't speak about the pharmaceutical.
Mm-hmm.
We need to teach the doctor and pharmacist what is halal and non-halal ingredient and
Yeah.
how to replace. How to replace? Do you want me to speak about replace? Because
Yeah. 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 Look. Yeah.
Mhm.
The
Yes.
more you explain, the better.
This is not for normal people. This is for pharmacist and doctor.
Uh-huh.
But I try to make it simple for the normal people.
Yeah.
We have something we call it ATC classification. ATC classification. This is classification from the WHO,
Okay.
World Health Organization.
Organization. Yeah.
It's anatomical, therapeutic, chemical classification. So they classify all medicine around the world according to their anatomic region.
Mm-hmm.
We classify body into systems:
Mm-hmm.
neurological system, intestinal system, respiratory system, cardiovascular system. This is
Mm-hmm.
anatomical. Then they go for therapeutic. What is the action of the medicine?
Yeah.
Then chemistry, which chemical family they are. Okay. So each medicine take ATC code from five numbers, number and alphabet. Each one have code. For example, paracetamol have code. Morphine have another code.
Mm-hmm.
Uh, when you have uh, the same ATC number, that means it's the same medicine.
Okay.
The same medicine. The same medicine we have different brand.
Okay.
It's one what we call it generic brand.
Mm-hmm.
For example, paracetamol have one ATC code,
Mm-hmm.
but in UK they call it Panadol. In different country, they call it Barol. Another country, they call it Rivanin. It's according to the. This one can replace easily by the pharmacist because
Okay.
it's only brand,
Mm-hmm.
only brand.
Mm-hmm.
Sometimes we have one brand is not halal, another brand is halal.
Yeah.
So pharmacist can easily replace, doctor can easily replace
Mm-hmm.
this one.
Yeah.
Now we have another medicine. They are same in the four number of ATC, the first four number, and not same in the last one. So they
Mm-hmm.
are from the same family. They are from the same family. For example, omeprazole. This is medicine for peptic ulcer. Okay, this one, anything from azole, azole family can be replaced with it,
Okay.
and this is pharmacist or doctor can replace because they are from the same family.
Yeah. Yeah.
But there is some differences. يعني, when there is different in the ATC code more than two numbers or two alphabet, that means they are not from the same family but from the same section, from the same subgroup. This is need doctor approval
Mm-hmm.
to
Mm-hmm.
replace.
Mm-hmm.
And when it's not the same ATC, only two numbers is same. This is only in critical cases we can replace.
Okay.
When there is emergency and we don't have something, we can replace only in this case. This is we teach our student in the second year, third year pharmacology student when you can replace, when you cannot replace.
Replace. Yeah.
But this is not for consumer. This is
Yeah.
for
I know.
pharmacist and for doctor. They
Yeah.
should know that as Muslim doctor or as Muslim pharmacist, when I have two brand, they are the same 5 ATC code. I can replace easily. 4 ATC code, I can replace easily. The problem with the three digit one. Um, the problem also that sometimes we don't have halal alternative until now. For this medicine, still Muslim can be used. There is fatwa. I translated to Arabic, to English. If you want, I can, how to say, read the level when we can use non-halal medicine.
Yeah, please go ahead.
Okay.
If you have it to hand already. If not, we can go.
Yes, I have it with me.
Okay, okay.
Uh, Number one, the medicine has to be prescribed by competent Muslim physician. This is number one.
Yeah.
Okay. Number two, it should be life-saving or essential for healthcare product.
Okay, okay.
The patient is suffering from intensive healthcare issue without getting such product. Yeah, and that's mean if he didn't get this product, he will has some problem. This is will lead to his death or damage in his body part. Uh, next next level, an alternative halal to haram ingredient is not available. The alternative halal is available, but the patient is not responding or getting benefit from the healthcare products by using this halal alternative. So we try the halal one, but the halal is not working.
Yeah.
We can use the non-halal one. The alternative halal is available, but it's not accessible by the patient. It's very far in another city or another hospital. We cannot get it at the right time. The alternative halal is available, but is too expensive and out of reach of the patient at this time. And the last one, the Muslim physician accounts that healthcare products containing haram ingredients give maximum cure to the patient from this chronic disease.
Yeah.
And the haram but tahir healthcare products are not allowed for oral use.
Yeah.
Sometimes it can be used another non-halal one. This is the level of the fatwa that when we can use non-halal medicine. So sometimes we have halal alternative, but it's very far. Some we have halal alternative, but it's expensive.
Yeah.
But every time the fiqh people said, the final decision will be for Muslim competent doctor
Doctor.
or pharmacist. This is the responsibility for them. But
Yeah.
where is the weak point here? That unfortunately until now we don't have curriculum or book which teach the doctor and pharmacist what is halal pharmaceutical and which ingredient we should avoid or not. I'm working on this one from 10 years.
Inshallah.
We supposed to have halal pharmacopoeia project, um, halal list for non-halal medicine and doubtful ingredient. Inshallah, it will be published soon. Yeah, we're
Inshallah.
working this on SMIIC level and also on the personal level, inshallah.
Inshallah, inshallah. The other question I wanted us to address is in the UK and other parts of the world, again, non-Muslim country or Muslim minority countries, uh, every year parents will receive information from schools to say, look, you need to take flu vaccine for your children, and mostly they will indicate that the flu vaccine has got pork in it. So what I want you to say is let's take COVID and also the flu. In those two instances, can you accept the non-halal vaccine? I know COVID, some people argued that some of the vaccines were halal, but I'm just saying COVID, people's lives were at risk. Flu, some people's lives may be at risk. In those two instances, can you take a non-halal vaccine?
Mhm. Bismillah. Okay. Let's think like fiqh people also.
Yeah,
We have compulsory vaccines
yeah,
and we have some vaccine which is not compulsory, it's occasionally vaccine, and we have recommended vaccine.
okay,
Okay. We can add another group which we call it vaccine which is promoted by companies, not by government, by companies.
yeah,
Okay. The compulsory vaccine, it's a few vaccine usually given in the childhood time, and they are for childhood critical life danger disease.
like polio. Polio could
Yes,
be one.
yes.
Yeah,
polio, diphtheria, tetanus,
Mhm.
typhoid. Every country have their compulsory one.
Yeah.
And this one, if you didn't give for your children,
Hmm.
uh, يعني you will be questionable by Allah subhanahu wa ta'ala
Yeah.
because you
You're
treating your
putting,
children.
yeah, you are
It's,
putting their life
even
in
it's
risk.
contain non-halal
Yeah.
material.
Yeah.
This is يعني we should take it even if it's contain non-halal material. By the
Okay.
way,
Okay.
the non-halal material is very small uh, portion.
Hmm.
It's يعني very small one. Usually it's enzyme used during the process. Sometimes it's cell line, what we call it cell line. That's mean to make vaccine for a virus, for example. You know that virus is not living outside the cell.
Yeah.
So we put the virus inside cell,
Hmm.
then we get this material and we extract it from the cell. So the cell line, usually it's from porcine, sometime from dog, sometime from human, long time ago, not now. Two or three types of vaccine made by human cell line. We
Yeah.
have cell line from hamster, cell line from monkey, cell line. So the problematic is the cell line sometime. Sometime the culture media that we use it during making the vaccine,
Hmm.
sometime the enzyme that we use it. So we don't put the vaccine, the non-halal material directly. It's enzyme or cell line or something like this. So for the compulsory vaccine, they should take it, and most of them is halal. The majority of them is halal,
Hmm.
and if it's contain non-halal material, it's allowed to be taken.
Okay.
And our fiqh people in the fiqh academy, they allow these things.
Okay. Okay.
Now there is some conditional vaccine. If you
Mhm.
travel to one area, the country asks you to take this vaccine to
Yeah.
prevent yourself. Okay, like Hajj vaccine, the Umrah vaccine sometimes.
Yeah.
Uh,
Again, I'll
uh,
give you another example. If you traveling to Ghana from here, they will ask you for yellow fever vaccine.
yes, I take this one. I travel to
Okay.
Uganda.
Yeah.
Yeah, I take this
Yeah.
one. So some African country. If you go
Mhm.
to Japan from outside, sometime they ask you for vaccine for Japan disease.
Okay.
They have this Hajj Umrah vaccine is meningococcal inflammation vaccine because a lot of people come to the same area, and if they don't have this vaccine, this disease may spread
Yeah.
among people. So this one, if the country requests you to do it, it's also compulsory to do it
Hmm. Hmm.
as fiqh from the fiqh principle
Yeah.
because it's to protect you and
Yeah.
protect other people. Now
Hmm.
there is some conditional vaccine. The government make it not compulsory. It's conditional one.
Hmm.
Okay. Now this one you are free to do it or not to do it.
Okay.
Some people said, yeah, a lot of fiqh people they said if it's prevent disease and if it's prevent your child or prevent this guy, it's okay. It's not haram until we have the halal alternative. So in general, the fiqh people are very flexible. All of these types you can take. The only one which is you cannot take it is the one which is promoted by companies.
Okay.
Some companies they said this is our vaccine for this disease. This is it's
Hmm.
not dangerous disease. You just need to take it as yani, extra caution.
Hmm.
This one, if it's contain non-halal material, it's not you are not allowed to do it. So you should know your type of vaccine before you go to this one.
Yeah.
But to mix between these types and said, I don't want this one. I want to apply this rule for this one. It's not right.
Okay.
Uh, because some people against vaccine, you know that some people against vaccine. I can say yeah, clearly it's compulsory for you to give your child the compulsory vaccine, and even if it's contain non-halal material. And just to let them relax, the non-halal material is in only in two or three vaccine, and in very small portion, it will not affect, inshallah. And it's this is the fatwa from Islamic Fiqh Academy.
Look, it's very good that you've taken your time to explain everything because there are some companies, some pharmaceutical companies that are just advertising, oh, if you take this vaccine, you are this, you are this. But it's good you differentiated it from compulsory and also life threatening. So we gave the example with polio, life threatening vaccines, which can
Yes.
save you, the life of your child. If you don't do it, look, you are being reckless, you are putting the life of your children in danger.
Actually, يعني every time I said our fiqh people they are يعني taking their time when they
Yeah.
speak about these things,
Hmm.
especially in the Fiqh Academy. I'm speaking about the experience of the Fiqh
Yeah.
Academy, because it's very dangerous to take from only one sheikh in this issue. You should take from academy or a group of people because it's not easy to take decision about this one.
Hmm.
But the people in the Fiqh Academy, they study the all types and they make many consideration and they decide that this one, if it's life threatening, childhood threatening, it's yeah, it's obligatory, it's compulsory for you
Yeah.
to give your children. And they make one, how to say it, one promotion for the polio because some people start to stop polio in Pakistan and Indonesia,
Okay.
polio vaccine. And some sheikh go there and they educate people that
Okay.
it's halal because
It's
the polio, for example, it's contain only one enzyme, which is go in process, and this enzyme is from porcine source. Now, our job as Muslim pharmacists, as researcher, as company holders, to find this enzyme from halal source.
yeah.
This is يعني it should be in our target in
Yeah.
next
Yeah.
time.
Yeah. 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 Alhamdulillah, alhamdulillah. So again, Dr. Muhammad, I am from Ghana. I was born in Ghana and I grew up in Ghana. And in Ghana, there are some Christians who will not take organ transplantation, who will not take blood transfusion and things like that because they believe they're and I mean proper Orthodox Christians. Is that the same case in Islam? Can you take blood transfusion? Can you take organ donation? What's the position in
Yeah.
Islam?
In Islamic Fiqh Academy resolution, before the Islamic Fiqh Academy, by the way, for blood
Yeah.
transfusion,
Hmm.
it was from the first medical fiqh resolution made by the OIC countries. It was in 1965.
Yeah.
They make a decision in at that time that blood transfusion is halal
Hmm.
and there is no problem and it's halal to transfer from Muslim to non-Muslim, from non-Muslim to Muslim, because some people was asking about this question. I transfer blood from non-Muslim to Muslim or from Muslim to non-Muslim. It's okay, and all blood product is okay because
Yeah.
it's not only what you call it blood, because we have red blood cell, blood platelet,
Yeah.
plasma. We
Uh-huh.
have around 10 products made from the blood.
Mhm.
Any type of blood transfusion is halal
Okay.
according to this resolution 1965 before the Fiqh Academy.
That's very good to
For
hear. Yeah.
yes, for organ transplant, it's also halal by another resolution made in 1985, 1986. I can later give you the number for the resolution,
Yeah.
but they make some condition to make sure that it will not become trade,
Mm. Okay.
because some people will go and sell their organ.
Mm.
So they make
Okay. Okay.
fatwa and they say that it's prohibited to
Sell.
sell the organ.
Okay.
Now there is some famous sheikh
Yeah.
which said it's organ transplant is not okay because your body is not your own. You should not do something that you don't own to another people. But this
Yeah.
is individual fatwa. Usually we take by the majority.
Hmm.
The
Hmm.
majority, yes, organ transplant is okay, but they make a lot of condition to make sure that it will not become trade.
Okay. Okay.
Yes.
Okay. So trading in organ is not good, but transplantation is good if it's offered voluntarily,
Yes,
free
if
of
it's
charge.
voluntary,
Yeah.
it should be okay.
Yeah.
But if it's become part for business or these things,
That's
it
not
will
good.
not be okay.
That's not
And they
good.
make a lot of condition for this one. Now we have another blood product,
Yeah.
not blood transfusion. We call it blood product.
Yeah.
If it's tablet, it's not halal. Okay. If it's injection, we still
Yeah.
discuss in SMIC standard now. By the way, we have SMIC standard for halal pharmaceutical. We publish standard number one, which we call it OIC SMIC 50-1. This is general guideline.
Hmm.
Another standard, OIC SMIC 50-2.
Yeah.
This is for halal biopharmaceutical.
Hmm. Hmm.
When we say bio, it's anything made from another living organism. Vaccine is part of the biopharmaceutical. Blood product is part of the biopharmaceutical. Probiotic, prebiotic, this is biopharmaceutical. Immunoglobulin, immuno. interferon, all of these considered as biopharmaceutical. Now we are making the standard for this one.
Okay.
So the blood product, we have some injection, we give it. It is anticoagulant. It will stop, it will help you to make, to stop the blood bleeding.
Yeah. Yeah.
Okay.
Anticoagulants. Yeah.
This one, is it halal or not? It's still under discussion in the committee.
Yeah.
We don't discuss if it's halal or not. It can be classified as halal. It can be given as halal logo or not.
Yeah.
This is what we discuss now.
Okay. So if somebody's listening with us to us and they don't know what SMIIC is doing, how many standards do you have? Do you have one or two just slaughter and pharmaceutical, or do you have more standards than that? Just for somebody who doesn't know what work you guys are doing, how many standards do you have for different fields?
Yes, you can go to our website. We
Hmm.
have a standard list.
Yeah.
It's published all our standard, and you can go to each technical committee in our website. You go to the technical committee. You can
Mashallah.
see the project because
Mhm.
standard take 2 or 3 years to publish.
Yeah.
So you can have a complete list from there. Until now, we have uh, 85 published standards
Wow. Wow.
in
Wow.
all fields.
Then that means you guys are not sleeping. You are not sleeping in the office. You are.
No, no, it's group work. It's not one person work. It's a
Mashallah.
group work.
Mashallah.
So it's
Mashallah.
not only in SMIIC General Secretariat, we are 10 people or 11 people.
Yeah.
Okay.
Mhm.
With His Excellency Mr. Hassan, we are 11 or 12 people.
Mashallah.
Um, uh, we are just managing the meeting,
Yeah.
but the country send their experts. So we have more than 1,000 experts from all
Mashallah.
OIC countries. In halal field, we have 20 standards in
Wow.
halal field. So we have halal food, 4 or 5 standard.
Mhm.
Halal cosmetic, one standard, it will become three soon, inshallah.
Mhm.
Halal pharmaceutical, we have one standard, it will become three soon, inshallah.
Inshallah.
Halal supply chain, we have three. Halal management system, halal tourism, halal, what we call it, restaurant, all of these in halal. We have animal feed, this is under food, animal feed, gelatin, and others.
Yeah.
In other fields, we have petroleum, we have jewelry, we have what we call it, handicraft, other things, yani, agriculture. So it's nice to go and see this standard because the standard will make it easy to import and export product between OIC countries.
Yeah. Yeah.
This is the goal, inshallah.
Inshallah. Good to see the wonderful work you guys are doing. And also, it's important to let listeners know that the World Halal Summit is under your auspices. You guys are organizing the World Halal Summit, which is a great place. I spoke last year at the conference, and it's a great conference. My
Actually,
last,
we should,
uh,
yes, we should speak more to the people about our standard.
yeah,
Unfortunately, yani, we did a little bit,
yeah,
but we are more like governmental organization. We
mhm,
don't have a lot of focus to speak to the public, but
yeah,
inshallah, in the future, we'll speak more to the
inshallah,
public in this issue because if people
inshallah,
know, the demand will become and people will start to ask about this one. When there is more demand,
yeah.
the market will move.
Yeah,
Yeah, inshallah.
inshallah. Inshallah. My last question, Dr. Muhammad, is I'm going to take you away from pharmaceutical a little bit to my field, halal meat production. There are so many people who are moving to vegetarianism from meat consumption. Some will say it's for health reasons, some will say it's for this and that. But we also know that meat consumption, meat, when you eat meat, you get a lot of protein, good protein. And because of lack of meat, I am from Africa where there is a lot of people going through a lot of famine, hunger because of lack of nutrition because of uh, lack of meat consumption or insufficient meat consumption. Is it okay for a Muslim to say, I want to become a vegetarian? Although going vegetarian, you will lack some meat, some ingredients, some nutrients from meat. Is it okay for a Muslim to go vegetarian?
These vegetarian people, problematic people. Uh, actually, يعني, it's allowed to be vegetarian, no
Okay,
problem. But
okay,
what you believe is the problem. Now,
okay.
for example, if you said that I want to avoid meat,
Oh, Okay.
it's okay. But if you said I want to avoid meat because I think meat is wrong and eating meat is wrong and this is mistake, no, because Allah subhanahu wa ta'ala allow us to eat meat
Okay.
and it's the sunnah of the prophets
MashaAllah.
Sallallahu
MashaAllah.
Alaihi Wasallam and all other prophets to eat meat. So all prophets eat meat, not only our Prophet Sallallahu Alaihi Wasallam. So if you, it's just personal, you need just to avoid this one, or
Okay.
you don't like it. Some people were vegetarian and they go convert to the Islam. I find some friends, Indian friend like this one. So he
Mhm.
said, I all my life don't eat meat, so
Meat, yeah.
it's become difficult for me to eat.
For me
So
to
it's
eat.
okay for you
Yeah.
this one, but don't go to the belief and say that what Allah subhanahu wa ta'ala said halal, you say
Yeah.
it's not halal. This is
Okay.
the critical issue.
Okay.
Allah
Okay.
subhanahu wa ta'ala said that this thing is halal, you
Yeah.
cannot make it non-halal.
Oh,
Same, if it's non-halal, you make it halal, this is also problematic.
yeah. So
Okay?
that means you can decide, okay, I'm a Muslim, I want to avoid meat for personal reasons, but you cannot say, oh, the way animals are killed, I don't want the way animals are killed, or I don't support meat consumption, or I think meat consumption is a bad thing.
Yes, yes, this is against the idea of the Islam.
Okay.
Allah subhanahu wa ta'ala, the only one who has the right to make its things halal or not. And
Yeah.
Allah subhanahu wa ta'ala make this thing halal. If you make
Yeah.
it non-halal,
No.
there's something in your belief. You should
Yeah.
follow what Allah subhanahu wa ta'ala said. Now, some people, they think that this animal welfare people, they think that this is will affect the animal and they are, what you call it, threatened, they are living in non-good condition. Okay, improve their condition, make it good for them to
Living.
live.
Living. Yeah. Worth
But
living.
every time there is pain. يعني you cannot kill animal without pain.
Yeah,
Actually,
that's the truth. That's the truth people need to understand. Even removing animals from the farm is stressful.
yes,
Transporting animals is stressful. Slaughtering animals is stressful and
there is
painful.
pain. And the
Yeah.
Prophet ﷺ don't say that there is no pain. He
Yeah.
said, when you kill, okay,
Kill
just
well.
make it in well way.
Mhm.
Reduce the pain as much as you can. But he didn't say that it should be free
From pain. Yeah.
from pain.
No,
Actually,
that's
if
a
you
good
keep it
point.
to the nature,
Yeah.
nature is very dangerous outside.
Yeah.
Go and see all of these film in National Geographic, how the lion eats the animal. It's very painful.
Yes. Yes.
So
Yes.
these people is not thinking in this way. Also, if you go to the feeling, a plant is feeling,
Yeah.
and you are eating a plant all of the day, and they have emotion also. They have things maybe we don't feel, we cannot see, but it's really there. In my country, for example, in Syria,
Hmm.
old women they speak with their trees, and the tree become good when you speak with it.
Yeah.
And this is proven by long time that this plant has feeling and they have kind of sense.
Yeah.
So inshallah, these people Allah subhanahu wa ta'ala give them some hidayah and they think
Yeah.
that this is their choice
Yeah.
to eat, but
Yeah.
they cannot say for something what Allah subhanahu wa ta'ala said it's halal,
Halal.
it's non-halal.
Yeah. Yeah.
By the way, we have standard
Yeah.
project now
Yeah.
for halal vegetarian.
Okay.
Halal. We didn't decide the name until now
Hmm.
because the name we sometime we change it many times.
Yeah.
It's for halal vegan, halal plant-based.
Yeah.
Because not every vegan product is halal. Sometimes it's contain
Yeah.
alcohol,
Absolutely.
sometimes. So we'd like to make some standard for to become halal and vegan at the same time.
Additive.
Also for protein alternative, we provide our technical opinion for Fiqh Academy, for plant, for culture meat, and for insect protein.
Hmm.
Okay, this one can be accepted with very strict rule.
Hmm.
Insect protein can be accepted with very strict rule. Cultured meat can be approved by stricted rule. But I think the main problem, brother, not that we have less food. We have a lot of food, alhamdulillah, but this country, some countries take more than other countries. There
Yeah.
is no adl, there is no justice.
Hmm. Yeah.
Some people have things more. There is no
That is,
justice
yeah.
in
It's
this
true.
world,
It's
unfortunately.
true.
But we have a lot of effort, a lot of what you call it, resources in the world.
Yeah.
The
Yeah.
earth is enough for us
For all
and
of us, yes.
all
But
of the other generation.
yeah,
Some capitalism
equal.
people, they said this is Malthus theory that the earth will not become enough to produce food for the people. No, Allah subhanahu wa ta'ala say in the Quran that He make the قدر أقواتها. That's mean He calculate how much food and
mashallah.
risk will be enough for all of the
For all of us.
generations.
Yeah. Yeah.
So we have food. The problem with the justice in give it to the poor people.
Yeah.
If the rich people give to the poor people, no problem.
Yeah. I want to take you one step back. You mentioned something that many people will connect with. The fact that Allah subhanahu wa ta'ala, and even in hadith, in Imam Nawawi's hadith, he says, verily God has prescribed ihsan. Ihsan means doing things to the best of your ability. So if you're going to slaughter in the best manner. Sharpen your blade to spare animals too much suffering. So it doesn't say there's no suffering, but it says if you sharpen your blade, for instance, you can spare the animals some suffering. So it's very important that welfare is important, but we also recognize the fact that if you're taking the life of an animal, you are compromising the welfare of the animal to some extent, but we are advised to do it properly.
Yes, yes.
Yeah.
By the way, we have another standard project now.
Mm-hmm.
In SMIIC 1, we have a lot of animal welfare regulation inside the slaughterhouse.
Yeah.
How to lead the animal to the slaughterhouse.
Mm-hmm.
The animal should not see other animal when they are slaughtering, and a lot of requirements.
Mm-hmm.
But now we make another standard for animal rearing and
Okay.
transportation.
Mm-hmm. Mm-hmm.
What you should do and how big the car should be, the distance, the cage, the animal rearing. So inshallah it will be good. Yani, we are not against animal welfare.
Yeah.
Okay.
Yeah.
We are against these people who think that animal welfare is more important than halal.
Mm-hmm.
Halal is number one.
Yeah.
Animal welfare
Well,
come number two.
number two. Yeah. Yeah. Look, Dr. Mohammed, thank you very much for taking your time to come on to this podcast. I want you to take the next minute to give me what your vision is in the next 10 years for Halal Pharmaceutical in Muslim countries like OIC countries and also in non-Muslim countries. What is your vision? What do you want to see in the next 10 years?
Wallah, I have a lot of dreams in this one. Let's say dreams, let's say maybe some step we will do, inshallah. In education, I want to do something in education part to teach this new generation what is halal pharmaceutical, so they can lead and more demand will become.
Inshallah.
In regulation to make more standard on halal pharmaceutical, halal medical devices, and all other related things. And finally, in investing to make halal alternative. I have a lot of companies now start to find the halal alternative, but they need investment in this field. So, yeah, Muslim traders should invest in this one. There is high chance to get more money and also some risk. There is no gain without pain. So, inshallah, in the future, we have some investment in halal pharmaceutical, creating new alternative product, inshallah.
Inshallah. Thank you very much, Dr. Muhammad. And inshallah, if you need any clarification, I'll invite you back to come and speak.
Inshallah, but I just make one advice at the end. No one listen to the part of the speech without listening to the other part, especially in the fatwa regarding vaccine, because it's critical to say to the people this is halal and this is not halal. I'm just transferring the fatwa. I am not expert in Sharia. I am just degree in Sharia. So I just want to make this one. Maybe later I can send you the fatwa translated. We can attach it with our video, inshallah.
And also, Doctor, it's good you highlight the fact that it's good to listen to the whole thing, because sometimes some people can cut part of a video and it will not make sense. So we will appeal that if you are listed, because this is a very, very critical topic, if you want to listen to it, please listen to the whole thing so that you can understand exactly what we were talking about.
Inshallah.
So thank you very much, Doctor, for your time.
This is third time with you.
Yeah, that's really good. That's really good. Thank you very much.
Thank you for your time and for this good podcast, and for all your people who follow this podcast.
Inshallah. Thank you very much, Doctor.